abuse and opioids has become a major concern for communities across the country. And here today is Craig Schmid of the City of St. Louis's Department of Health to share more about the signs of abuse and what the city is doing to combat its spread. So Craig, I know your job is immense and difficult, and this is an issue, the substance abuse, substance use, opioids, we're hearing about it all the time. It's not going away.
Right, so I appreciate it because it's really something that everyone is working on. But in the city of St. Louis, for instance, in 2016, there were 273 deaths from opioids and, of course, many more overdoses. And then this past year, there were 256 deaths. So actually in the city, it reduced, but in the region overall, St. Louis County had 181 deaths in 2016, 203 in 2017. And just to kind of put it in perspective, there's about 3 persons every day that die in the state of Missouri from opioid overdoses. And this is the epicenter here in St. Louis City, St. Louis County, and the surrounding counties.
Okay, so the issue, though statistically it may look like it's going down in the city,
it's not.
It's spreading
statistically,
throughout.
right. So, but we're pleased at least that through a number of efforts, such as through the Missouri Hope project with Narcan and the issuance of some of that and people beginning to understand some of this, we are at least reducing in some quarters some of the deaths, but overall it's still increasing. The rate of increase is decreasing, which is a good thing.
Right, so Narcan is something that primarily our first responders carry, is that correct?
So EMS, all of our EMS folks have that. Some of our St. Louis Metropolitan Police Department officers have that, but generally speaking, EMS gets to the scene first. In St. Louis County, the officers also have it as well. And
so that's the Narcan can stop the death because it restarts the heart.
So it resuscitates you because opioids tend to suppress the breathing as well as the heart. And this kind of revives you and allows you to live for another day with the hope that you'll get to treatment and some of the other things that one needs.
Right. Okay, so substance use and substance abuse, which may be one and the same, depending on how you look at it, is a problem in our community and throughout the nation that it's really becoming a greater and greater problem.
Right, so substance use, I would say, as prescribed by a doctor, is one of the greatest things of modern medicine. Obviously, it's very helpful and we should all make sure that we're appropriately doing that. But 30 years ago, opioids were not as readily prescribed as they are now for pain. And then there's the abuse issue. So sometimes people are, let's say you go in for a toothache or for your wisdom teeth to be pulled. And so you're issued, let's say 30, 60, 90 days, probably not 90, but a long period of time for the opioids to reduce that pain as you're recovering. Now the state of Missouri has a law that says that basically the default is only to issue 7 days.
Okay.
So you generally don't need as long of a period of time. It also then, the problem is that if you leave that in your medicine cabinet, you haven't used all of those, you've not disposed of it properly, then somebody else can come in there and get those and use them improperly.
Yeah, and I learned actually, I took a prescription. One of my kids had some oral surgery, just like you're talking about, and we took the prescription to the pharmacist, and I learned that we didn't have to have that entire prescription filled. So it was for, let's say, 20 pills. We only thought we would need 4 or 5. And so the pharmacist filled exactly what we wanted, so we didn't have that surplus in our home. And I didn't realize that, and I probably, most people don't realize that you don't have to take that full prescription.
So under that legislation, the doctor is also supposed to let you know about that so that you're not as likely to do that. So I always say to speak out, that is, have this discussion with your doctor about what the relative benefits and harms that might be with that. Opt out so that you can go through other regimens or other ways of dealing with the problem, and then throw out, because there's specific ways of doing that, and there's opportunities that we may talk about later about that.
Yeah, and we're going to take a quick break right now and come back and talk about that and other ways that the city and our metro area is trying to combat this issue. So stay with us at STL Live. We'll have more with the Department of Health and Craig Schmid after this break.
Is that fun?